Untitled the fear of spiders, to Acrophobia, the fear of heights, to the silly ones like Phobias, the fear of fears, and even the more outlandish phobias like Levophobia, the fear of things to the left side of your body. These also include Demonophobia, the fear of demons, Tetraphobia, the fear of deformity, which includes pregnant women, Panthophobia, the fear of disease and suffering, and Selenophobia, the fear of the moon. And Nomophobia may be a phobia that you guys suffer from because it's the fear of being without your cell phone or losing signal. Phobias are an anxiety disorder that affect most everyone, with 4 to 5% of Americans having one or more clinically significant phobias, with women suffering from them more than men. Worry, fear, and challenge are all perfectly normal. A fear becomes a phobia when it affects your daily life. Most sufferers of their phobias know that they are irrational fears, but they're unable to control it. The social phobias, like speaking in front of people, usually onset between ages of 15 and 20, and nearly 15 to 20% of us will experience a phobia in our lifetime. They affect people of all ages, all walks of life, and in every part of the world. However, those in an urban setting are more likely to suffer from a phobia than those in a rural setting. Famous people like Oprah also suffer from phobias. She has Acrophobia, which is the fear of bubblegum due to childhood circumstances where her grandmother took her already chewed gum and put it on their furniture. And Princess Kate Middleton is afraid of coins. Even some of the most infamous people, like Hitler, suffered from phobias, and he suffered from a phobia of cats, also known as Allurophobia. According to the Diagnostic and Statistical Manual of Mental Disorders, there are 5 subgroups of phobias. There's animal phobias, like Cynophobia, which is the fear of dogs, fear of natural environment events, like Lilithophobia, the fear of tornadoes, the fear of blood and injections, it's called Hematophobia, which is the fear of seeing blood, fear of specific situations, like being afraid of the elevator, and other fears, like emetophobia, the fear of throwing up. An estimated 50 to 80% of people affected with a phobia are also found to have another mental disorder, and those who have their phobia starting earlier in life are those who are more likely to have another mental disorder. The top 10 most common phobias are Arachnophobia, which is the fear of spiders, and it's more common in women. Acrophobia, which is the fear of snakes. Acrophobia, the fear of heights. Agoraphobia, the fear of hard-to-escape situations, which 1/3 of people with panic disorder develop agoraphobia. Cynophobia, the fear of dogs. Astrophobia, the fear of thunder and lightning. Terpenophobia, the fear of injections, and social phobias, which are social situations which affect nearly 3% of the world's population. Pteromophobia, which is the fear of flying, which I do not like. Mesophobia, the fear of germs. Some of these phobias are treated with exposure therapy. However, not all phobias need treatment unless they affect your daily life. And only 23% of those affected seek medical treatment, but more on that later. The type of phobia a person develops is affected by their culture and ethnicity. Somebody in a third world country isn't going to have a fear of not having their cell phone. And the amygdala is thought to be responsible for causing specific phobias and needs to be further studied to understand phobias better. Also, according to new research, some believe phobias may be memories passed down through generations in DNA. However, there are a number of explanations as to why phobias are caused, and here they are.
Several phobias develop in early childhood between the ages of 4 and 8 years old. Certain experiences can grow into a phobia, such as being stuck in small spaces as a child. You can develop claustrophobia in adulthood. Doctors say that phobias are not genetic by the mother or the father, but a child can pick up on a phobia from a parent by being well aware of the parent's fear and making them fear it as well. It's very unlikely for people to develop phobias in adulthood. It's more likely in childhood and teenage years. Phobias can be a learned fear, which is something that you pick up over time. The three main types of fear are directly learned fear, observed learned fear, and indirectly learned fear. Directly learned fear occurs when a person experiences a particular place or object that causes pain or intense fear. Like if someone knocks down a bee's nest and gets stung by a bunch of bees, they're more than likely to develop a fear of bees. Observed learned fear is learning to fear a place or object based off the people around you. Like if a child's parents are afraid of spiders, a child is more likely to develop the fear of spiders as well. Indirectly learned fear is being informed of the dangerous nature by media or hearsay. Like someone may be afraid of driving by hearing about car crashes on the radio or seeing a news report on the news about a really bad car crash. Psychological influence is how a person thinks about an object of fear. There are 4 types of psychological influences, including perception, negative belief, heightened awareness, and obsessive avoidance. Heightened awareness is when a phobic person will often be more aware of the object of fear than other people. A person that's more aware of something builds up feelings of fear, making it more frightening when they actually experience it. Perception is the person may exaggerate their fear. It doesn't seem very scary to people, to ordinary people. Like if somebody's afraid of dogs, they may see it as dogs being like dangerous creatures, when in reality they're small, harmless animals. The exaggerations become real over time, making the person avoid the object and feelings altogether. Negative belief. A phobic person may make the object feel more scary than it actually is, like saying that a plane shouldn't be able to fly because it's too heavy. And obsessive avoidance. Phobic people obsess over the object that they feel. Refusing to face the object makes them fail to learn that what they actually fear isn't always harmful. People usually fear what they don't understand, so facing your fears is a major step to understanding and accepting that it is safe. And there's a lot of symptoms that go with fears, and that's
So there's definitely a difference between being afraid of something and having a phobia of something. If you're afraid of something, then you just stay away from that thing is probably just as humanly possible. You stay as far away from that as possible. But if you have a phobia of something, some other symptoms can be a pounding heart, maybe trouble breathing, chest pain, or tightness in that area. You'll know when you have a phobia because every basic function of your body will pretty much shut down. And you'll become pretty much useless. You can also feel mild feelings of apprehension and minor anxiety, or you could have a full-on panic attack. Like I mentioned earlier, the closer you are to the thing you have a phobia of, the greater your fear will be. Now there is a phobia out there that has, the symptoms are a little bit different. Hematophobia, which is the phobia of blood injection injury. When someone with this phobia is confronted with their phobia, they not only have a feeling of intense fear, but they have a feeling of disgust as well. Like most phobias, you initially feel anxious as your phobia is near you, but However, unlike most other phobias, you'll have a heart acceleration followed by a quick dip in your blood pressure, which can lead to nausea, being dizzy, or you can even pass out. And although specific phobias have the fear of fainting along with them, hematophobia, which is blood injection injury, is the only phobia where fainting can actually happen. Now, another couple symptoms to be knowledgeable about are the feeling that you must avoid your fear at any cost possible. In some cases, you can get anxiety by just thinking about what you fear often, and the knowledge that your fear is irrational or grossly exaggerated, but you will feel powerless to control them. I mean, honestly, even some phobias can cause you to stay in your house and away from everything, just because those symptoms can get that severe and debilitating. And that is just the tip of the iceberg with the symptoms of phobia. Now, this is the part where I just run down the list of the symptoms just so you know what you've got is a phobia, or just an intense fear of something, or if you're just being that guy and you really don't want anything to do with it. The physical symptoms are sweating, trembling, hot flashes or chills, a shortness of breath, a choking sensation, a sensation of butterflies in your stomach, feeling faint, numbness or pins and needles in your hands and feet, dry mouth, a need to go to the toilet, ringing in your ears and confusion or disorientation. And psychological symptoms are the fear of losing control, the fear of fainting, feelings of dread, and even the fear of dying. And well, that's it. I've walked you through the symptoms of every phobia there is. Now, Eric here is going to tell you how you can treat them.
Hello. I will go over some of the treatments used to help individuals overcome their phobias. We already mentioned some different factors contribute to different phobias: genetics, brain chemistry, environmental triggers, learned behaviors, and the treatment can change depending on what kind of trigger the episode or the level of the episode. Some people will get nervous, act up, like get dizzy or whatever. Some people will completely lose control over themselves, and that's when you know you need to get some treatment. So it depends on what kind of treatment you need, because they use different ones. And if they think it's based on brain chemistry or genetics, they usually try to start with pills, according to what I was reading. So that's why after you see the professional, if you think that it's created by brain chemistry or whatever, or they can use regular therapy just to help you control what's happening when one of those episodes happen. You know how to control yourself. So they can use individual therapy, group therapy. That way you can get with other people that are having the same issues that you have, and you guys can help each other and support each other. So one of the treatments they're using lately is the CBT, cognitive behavior therapy, and that would expose the person to the phobia, but on a controlled environment. That way the person they're not going to put them with a real poisonous snake in there. So they just like everything's controlled. And now they're using virtual reality. That's one of the new technologies they're using, instead of like bringing a spider or a snake or something on the person. Just like through those through that technology, they can actually like be exposed and they like 100% safe. So another therapy that's being used is flooding the individual, visualize or is immersed in the fear reflex until the fear itself fades away. That sounds pretty bad. That treatment sounds like fun right there. But if it helps and it's proven, like, I don't see why not. Modeling individuals who can watch other individuals exposed to the fear and see how they react, and pretty much that way they can try to control it themselves when they're exposed to the threat or to the fear or whatever causes phobia. So we got a little video.
say, you know, I'm terrified of insects. And the rational response would be, but really, insects are nothing to be afraid of.
When fears become excessive or irrational, they are classified as phobias. Dr. Victor Canary, Director of Child and Adolescent Psychiatry, the North Shore LIJ Health System, specializes in treatment of phobias through cognitive behavioral therapy.
Cognitive behavioral therapy really tries to identify the thoughts, isolate the behaviors, and create rational responses to these thoughts to help people not find themselves behaving in a way that will interfere with what they want to do. Night terrors are a particular kind of developmental phenomenon that can occur in children where they may appear to be awakened in the night, very frightened. They could even sit up in bed. They can be startled. They can be screaming. It's not uncommon during a phase of normal development for a child to go through a phase of having night terrors, and they're usually self-limited. They may go on for a period of a few weeks or a few months, and usually they resolve on their own.
So that was some more treatment and how they use it, and they use it for different phobias and different types of issues that people got. They use it's basically the same therapy, but in some cases phobias will not go 100% away, because it's just to help you develop skills so you can overcome your fear and like live a normal life. So it's just so the individual can achieve a better quality of life, and some of the most successful treatments are a combination of medicine and therapy. And that's what they're using, so it really helps. Just it's too many symptoms, so most of the time both professionals are going to have to work coming up with a plan. So that's pretty much it depends if it's going to be like long-term or short-term treatment. But that's just some of the treatments they offer. So now you know, if any of you have any issues with that, you can like get some help, because it's out there. So now I'm just gonna let Matthew come up, and he's gonna go some of the emphasize some of the points that we went through today.
Well, here's a personal story for me. When I was 9 years old, I had a fear of operating anything that made loud noises. Blenders were the worst. They were just scary things. Another thing that bothered me a lot was vacuum cleaning. Just loud noises that I had to control, just pressing a button, turning it on. It never made any sense to me, but it bothered me for some reason. I never told any of my family about it, because I knew that the fear was illogical. I knew that my family would think that I looked kind of stupid. So I forced myself to phase up those fears, and one day I was like, I made a smoothie, and I conquered that fear, and I just felt like I could take on the world because I turned on blender. But that shows the difference between regular fears and a phobia. Regular fears usually have some sort of justification of itself. You know, you're next to a cliff, you know, you're a little bit afraid of falling off. But suppose you have a phobia of heights, you would completely avoid the cliff, completely. Most people have a phobia. Some people have it without even knowing it. Or at least they know that they're afraid of it, but they don't realize it's actually a phobia. My sisters all have a phobia of cockroaches. It's crazy. It's enough for them to huddle in a corner and just, fetal position and just cry. But they know that cockroaches won't touch them, or they might touch them, but they won't do anything to them. But you can have a phobia of virtually anything. It's okay to be afraid, but it's not okay if it affects how you live your life daily. If it makes it so that you turn down a job that is up on a 10th floor of a 10th-story building, then that's things that will impact your daily life. So I want you all to look around the room and pick one object, just focus on it, and think of yourself being afraid of that thing. It doesn't have to make any sense, just anything. It can be erasers or markers. But if you think about that, the illogicalness of it, some people have crazy things like that object that you may have picked. Odds are, at some point in history, somewhere, at least one person has had a phobia of that object you picked. And actually, speaking of crazy things you might be afraid of, here's a fun video of really, really strange ones. And just for fun, I'm going to try to pronounce them. See how that goes. So you have their arachnophobia, which is the fear of peanut butter sticking to your mouth. Genophobia, which is the fear of chins. Juniophobia, which is the fear of knees. I have that one. Hexaphobia, which is the fear of the number 666. Palatophobia, which is the fear of bald people. And phallatophobia, which is the fear of becoming bald. Telogenphobia, which is the fear of beautiful women. Metaphobia, which is the fear of children. Phorophobia, which is the fear of clowns. Methaphobia or photophobia, which is the fear of alcohol. Paraphobia or sexophobia, which is the fear of the opposite sex. Gamophobia, which is the fear of marriage. I know people without have that one. Epiphalophobia, which is the fear of seeing, thinking about, or having an erect penis. Teratophobia, which is the fear of bearing a deformed child, or fear of monsters or even deformed people. Lachnophobia, which is the fear of vegetables. I don't know, maybe they'll kill you or something. Phasmophobia, which is the fear of ghosts. Thanatophobia, which is the fear of being already dead. Phobophobia, which is the fear of phobias. Panophobia or pantophobia, which is the fear of everything. Hippopotamus-squatidaliophobia, which is the fear of lungworms. In general, people can only be capable of having one.